About 8 years ago, we decided to have our recitals be a fundraiser for the Vasculitis Foundation. I got to know vasculitis when my daughter got the disease at age 10. Anybody can get this disease. It's not just for young children. It can be for older adults, older people, all races, all genders. But it's especially devastating when children get it because it's very harsh on their bodies. Basically what vasculitis is your body develops antibodies that will attack its own organs. And if it's not caught soon enough, 30% of people who get vasculitis die. Of the people that survive, several of them lose organs. And in my daughter's case, her kidneys were attacked. Fortunately, it was diagnosed early enough that her kidneys were saved, so she's okay. But that is another thing about it. So if it's caught early enough, there's treatment. There's no cure. The treatment is to lower your immune system, and that is done through chemotherapy and steroids. So for my daughter's situation, she had to stay in the hospital for 3 days with an IV treatment of those harsh chemo drugs, and then once a month she had to spend a night to get more chemo drugs for about 6 or 7 months after that. It puts the disease in remission, and then you don't know when it'll come back. When it comes back, you do the whole treatment all over again. So it's been 10 years now since she first got this disease, and now the treatment is a shot for 4 to 6 hours to administer the shot, and then you don't need it again for another 6 months to a year is what the doctors tell us, but I'm pretty sure it's been about 2 years since she's had this shot, so she's doing pretty well right now. My daughter actually is the teacher at North Kirkland Community Center, and there's a few students here that will be performing. So she is doing well. Her disease is in remission. If you look at her, she looks like a normal adult, which is good, except for she takes a handful of pills every day. The Vasculitis Foundation provides support for families and doctors. So when she first got the disease, I didn't know anybody. I'd never heard of this disease before, and it was very, very isolating. And through the Vasculitis Foundation, I was able to contact another mother who had a daughter close to the same age as Paula, and that was very encouraging. And it was just to share stories and what we had both gone through, what treatments her daughter had. It turned out we both had the same doctor because we both went to Children's at the time. And it was very, very helpful. Vasculitis Foundation also provides support to doctors. Here in the Seattle area, we have a great medical community. But if you lived in Montana or, I don't know, Iowa, there may not be as strong of a medical community as there is here, and you may not have all the different patients that the doctors here have with that disease, and then you may not know what the latest treatment is. So the Vasculitis Foundation will pair up a doctor that's in a remote area with a doctor that's more current with the disease so that you can treat your patient with the most up-to-date information. It also provides funding for research, and I told you about how the drugs have changed over the last 10 years. That's a result of the research that has happened, and we're hoping that they continue to do research and maybe come up with a cure, which would be very nice. So we have a donation box, and if you want to write a check, please make it out to the Vasculitis Foundation. We also have some pamphlets. If you want to pay by credit card, there's a form in there. And of course, if you have any questions, you can talk to me or to Paula. We are fine talking about it too.